Hello, and welcome to today's talk on insurance needs. My name is Regina DeMeo, and I'm a family law attorney in Maryland and DC. And with me today is Larry Thaul from Ascela, and he's been doing insurance since 1984. Thanks so much for being here, Larry.
Thank you.
So I know that open enrollment closes for a lot of people today, if not already. But if you could maybe just cover some tips for people, especially as they look at the new year, what are common mistakes that people make when signing up for health insurance?
All right. Well, thank you for that opportunity. I want to help people. So many times, the main characterization is caveat emptor, because we think we're signing up for something that we're not. So, for instance, people go on their state insurance exchanges and they see a big name insurance company and they think, well, they're getting that wide network from that company. They have to be careful. What network are they getting? That's one of the main problems that we see. So that's a common mistake, to just presume by name only. Another is that many plans that are not on the exchanges or are not sanctioned or licensed, filed by the state where you live, are sharing arrangements or other informal arrangements where they're not really insurance, and they don't come accompanied by protections of the Department of Labor, financial services, insurance departments of your state. Another common mistake is that you believe that you're eligible for such a plan. So you say, well, I work there, I should have eligibility. Why didn't I get the paperwork? So you have to make sure that you and your dependents continue to be eligible. We have children living out of state, we're going to colleges, we have changes during the year, and we'll get to some of that later as well.
Yeah, so when considering the choices, what are the top 3 things you think people should consider?
Okay, so with real estate, they say location, location, location. I will give you 3, but I'm going to start with network, because that is the biggest fallacy. Again, referring back to what I said earlier, you want to make sure that your primary care physicians, your specialists that you might see with greater frequency, that they are in network, because many plans call themselves point of service, where you can go in network or out of network, claim by claim. But if you go out of network, they're subject to a totally separate deductible, which accumulates very slowly because it's reasonable charges. And the definition of that can be very confining. You might have to accumulate twice as many charges or more to achieve that out of network deductible. Okay. Another thing is many people are covered by small group plans, large companies too. But when you're covered by a large group plan, what you want to make sure of is, or a group policy, that the formulary that you get your medications through, this is as a group or as an individual, you want to make sure that medications are covered. So your medications. Now, medications are frequently divided into tiers, 1, 2, and 3. Tier 1 might not just be generics. It might be generics and lower costing medications to the insurance company. And those formularies, even though you sign up, say, on January 1st for the year, your benefit plan remains the same, but the formulary can fluctuate during the year. So you want to see what's on your plan and what's your fallback if you had to go to a tier 2 medication. Okay, another aspect is we now are in the world of virtuality during the pandemic, and that has really pushed us along in telemedicine. So you want to be familiar with what your telemedicine alternatives are, whether some of them, companies are not charging for telemedicine in order to promote it, or they've also, some companies have also given back some premium, maybe 1 month's worth during the pandemic. Some have just extended the ability to pay. But those are the main things: network, formulary, and the ease of the process. For telemedicine, filing claims, you have to know if your plan requires referrals or not. So those are the main things.
And outside of the open enrollment period, are there some life-changing events that will allow someone to enroll?
Oh, I'm glad you asked those life events. So I can just list them here. I'll amplify a couple of them.
Mhm.
So life events include loss of coverage. Now, remember, when you have such a triggering event, you have to take action within 30 days, might be 31 days. I'll say 30 for this purpose. And if you don't take action quickly, your life event open window closes. So you get married, you want a spouse on the plan, 30 days. You have a child, you want the baby on the plan, 30 days. You might have a divorce agreement. Now, sometimes divorces lend themselves to actual written agreements that the insurance company would follow. But 30 days, 30 days, 30 days. Another aspect that's relevant to these qualifying life events are shifts in employment. You went from part-time to full-time. So as soon as you get that offer letter, that's your open window. And many times you don't have to prove good health, uh, certainly not under the Affordable Care Act for medical insurance, but you might not have to prove good health for other policies offered to you only once upon initial open enrollment. Life insurance, disability, long-term care, some examples. Death of someone who shares your plan. So you have to make sure, what if you are the beneficiary of that, you're a dependent, you would have to make sure how long you would be able to continue under that plan, or you pass away, your beneficiary, your dependents may have a time limit. Also, you have to be a U.S. citizen. So frequently, Social Security, almost all carriers require Social Security numbers, and turning age 65. That'll bring on a whole other set of questions.
Well, that is my next question, actually. So when someone turns 65, do they automatically get enrolled in Medicare?
Good, that worked well. Well, as it turns out, age 65 is a trigger. Now, there's a 7-month initial sign-up period that the Medicare potential beneficiary must register. It's 3 months prior to the month they turn 65, plus the month they turn 65, the whole month, plus 3 months after they turn 65. That's the 7-month period. There are 2 main websites to look at because there are so many scenarios and situations. Our company, Ascela, has a department of employer services dedicated to such aspects, Medicare and other aspects, Affordable Care Act, compliance with all the myriad laws. But you can go to CMS, that's Centers for Medicare Medicaid, cms.gov, or medicare.gov. Also, there's a local Social Security office near you. Yes, Social Security helps with the onboarding for Medicare. And I think that probably answers. Oh, I think what's important also is to give otherwise intelligent folks an explanation of the various parts of Medicare, A, B, C, and D.
Mhm.
D is easy to remember, drugs, right? But a working knowledge is very important, and you probably get that through your professional advisor.
And I hear a lot about Medicare, like supplemental insurance. Is that important?
Yes. So it's for some, reaching 65 is nirvana, right? They've paid in their whole lives for coverage. Now they'll have it. If you work 40 calendar quarters in your lifetime, as you know, you get Social Security. Well, if you're hit age 65, you qualify for Medicare. Now, what you want to do is understand the gaps in Medicare. That's why Medicare gap insurance developed. Now, years ago, they came up with standardized forms for filling those gaps in Medicare. Letters A through J, those were the first 10. Now there are many more of those gap filling Medigap policies. So you'd look at, again, back to rule number 1, the network, right? How are your medications going to be covered? Formulary, ease of process. And why do I say it is that there in many areas there's Medicare Part C, where an insurance company accedes to the government benefit. They get paid by the government to take care of you, filling the holes in Medicare, but you must stay within their network. Period. So that's what you give back. So I think that helps a little. I think just so you understand what some of those gaps are. I mean, no one thinks of a multi-pint deductible on blood transfusions, right? That would not come to mind. Or a hospitalization separate deductible, a couple $1,000. Now, the Medigap, final note on Medigap plans are that Medicare Part A is generally everything pertaining to hospital care, and Medicare Part B are all the doctor visits. Medicare Part C is what I was saying, the private insurance company acts as the government, right? And then you have Medicare Part D, the prescription plan. So you just want to make sure which is best for you, where you're planning to reside in retirement. And you only have one time a year to make that change. Well, that date came and went. It was December 7th for that open enrollment. So pay particular heed, towards next year.
Yeah, so it doesn't sound to me like this is something that a person could navigate easily on their own. So do you agree that it's helpful to have a professional?
Oh, I have to tell you, I've been with the insurance professional societies for years and the associations, and everyone has their own expertise. You can be even an insurance professional and need a sub-expert to help you here. There's no doubt. So I would agree that, yes, the state and the federal exchanges where you can get medical insurance, they do have navigators and assisters that will help you enroll. They're instructed and prohibited from telling you which plan would be best for you. They can answer your questions, but they are not, as a professional licensed insurance broker or agent is, trained, licensed, kept abreast of all the machinations with the changes in law, regulations, and regulatory interpretation that the insurance companies make, right? So it's important for you to have, and I also feel, a local broker in many instances for an individual. Companies can have brokers that serve regions, if not national brokers, but you should look for a member of a professional association so you know they're getting kept up to date and informed.
And your company also does this on a bigger scale for companies looking at their various plan options, right?
Oh, absolutely. Thank you. Ascela is actually an assemblage of books of business of brokers over many years. For instance, mine a few years ago, I merged into them, and it's been wonderful because they have such depth in their ability. They have dedicated service people. So a brokerage can do that. So it's you against the mighty insurance company, right? You make a phone call, or you should have an intercessor, someone knowledgeable and connected who has a book of business with that carrier with some clout, and they might be able to get you a much better result, and also keep you informed as to what to consider during the year. That your advisor should not be there simply 30 to 45 days before a renewal cycle. They should be there all year long. It's a year-long commitment.
This has been great. So if people want to contact you for further information, can you tell us what's the best way to do that?
Oh, that's great. If you can screen, that would be ideal. Yes, email is best. I advise, you can't call me on my mobile. It's open to you. There are many resources that you should be aware of. People are using much higher deductibles now, especially at small companies. They're able to keep their monthly premium way down and just save in a tax-deferred account, maybe a health savings account to have for that big deductible to save up for it if they need it one day. But thank you for this opportunity very much, Regina.
Well, thank you. It's been great. And thank you all for tuning in. We'll see you next time.